Perioperative medicine for older people undergoing surgery, scale up, POPS-SUp, a study protocol. Surgery provides definitive management of many age-related diseases, relieving symptoms or extending life. Age-related physiological decline, multimorbidity, and frailty predispose older people to post-operative complications and incomplete functional recovery with resultant health and social care cost. These age-related conditions can be optimized using comprehensive geriatric assessment and optimization, CGA, thus mitigating perioperative risk to improve clinical outcomes with demonstrated cost effectiveness. This slide shows how a CGA-based perioperative model of care can be operationalized through a POP service in routine, elective, and emergency surgical care. National organizations advocate this model of care for older surgical patients. However, variation exists in the provision of POP services across the NHS. This results in inequitable access, more frequent complications, longer length of hospital stay, and greater financial cost. A recognition of this unwarranted variation in perioperative services for older people has led to the award of a £1.5 million NIHR grant to evaluate whether CGA-based POP services can be implemented at scale and improve clinical outcomes for older patients undergoing surgery with cost effectiveness. A mixed methods hybrid implementation effectiveness interrupted time series study will examine the use of a co-produced implementation strategy to embed CGA-based POP services at scale in the UK. Co-primary implementation effectiveness outcomes will be used, reach as the implementation outcome and length of hospital stay as the effectiveness outcome. POPS-SUp will use an embedded process evaluation, quantitative evaluation of clinical and cost effectiveness, and qualitative appraisal of patient and staff experience. The embedded process evaluation will use real-time framework analysis, enabling iterative refinement and evaluation of the implementation strategy. Appropriate approvals have been obtained across the UK, and a predefined dissemination strategy has been co-produced with patients, carers, the clinical community of practice, and organisational bodies. POPS-SUp will recruit 18 hospitals in two cohorts. These sites will ensure geographical spread and diversity in terms of local population and workforce resource. Each site will choose the patient population in whom the clinical need is deemed the greatest. For example, some sites will choose emergency general surgery and others will choose elective vascular surgery. Baseline data will be collected for 3 months. Following this, each site will be supported by NHS Elect to implement their POP services. NHS Elect use a trimodal program which includes a toolkit, QI support and data support, as well as expert mentoring that has been developed and tested in pilot work. Follow-up data will be collected throughout the 6-month implementation period and then for 3 months thereafter. We look forward to reporting on the results.